Hi, I'm Hope Witkowsky, your host of Senior Scene. In today's world, people living to be into their 90s is not an anomaly. On my show, you've seen some 90-year-olds playing golf and a 100-year-old making blankets for the battered women's shelter. That's thanks to the great medicine and all the wonderful doctors that are giving us information to live longer. But there's a big question. Are your wishes going to be met? Do you have an advance directive? On today's show, we're going to learn all about advance directives and how our wishes will be kept.
Well, please keep in mind that we're all mortal. And while it always seems too early until it's too late, it's never too early to begin planning for what would happen if you became seriously ill or seriously injured. And who would speak for you if you couldn't speak for yourself? And so that's why we encourage everybody to empower themselves and to demand, actually, from their healthcare providers, conversations about goals of care, courageous conversations about what would happen if they become seriously ill, and ways to fill out an advanced directive and have that, more importantly, just as importantly rather, to have that in their electronic medical record.
As we all go through the aging process, we hear stories from friends or even family members about a serious illness, or maybe even an accident that someone had that was so severe that that person became incapacitated and could not make end-of-life decisions for themselves.
Honestly, Hope, those stories are far more common than I think we all would want to believe. And it's unfortunate. I think, though, back to these examples that are so powerful. I remember someone that I took care of a number of years ago who had lost his wife to cancer a few years before. But had come through that really amazingly well with his 2 kids and was looking forward to retirement. He had worked a little bit later than some folks and was turning 75 and had this plan to travel the world and to be able to go around and see all of the sites that he and his wife had wanted to see and to really just honor her in that way. Mm-hmm. And unfortunately, about a week before he was set to take this huge journey, he started feeling a little short of breath, and he thought to himself, I should probably go get this checked before I go on this big journey around the world. And it turned out that he actually ended up having a very aggressive form of cancer that was discovered incredibly late. And at the hospital I was at, they started working and giving him chemotherapy, but it made his brain not work as well as it used to.
Oh my goodness.
And so over the course of just a few days, although he'd been previously healthy and planning to do this whole big trip, he lost the ability to be able to communicate around what was important to him. Wow. And then his 2 kids, we turned to them and said, what would your dad want us to do in this situation? These are the different options. This is the way we think about the types of care he may or may not want. Mm-hmm. And they'd never talked about it. And that's just such a hard place to be, right? Like, how do you, as a child, try to think about what your dad would have wanted? And then you're arguing with your siblings because one said, well, we think that even if there was a 1% chance of survival, he would want to continue getting more treatment. Mm-hmm. And then the other said, I think there's a balance here, and maybe 1% isn't enough. And that conflict when someone is super sick is very hard to negotiate.
It's not uncommon to find that most people do not want to talk about end-of-life decision-making. It's sad and depressing, so we make sure that our conversations never mention that topic. Dr. Gonzales has been a part of these end-of-life events and knows how hard it is for a family member to have these conversations. It's even more difficult if it's too late.
I'd never really had a serious illness before, and I never thought about having an advance directive. Thankfully, my heart is much better now, and even though I'm feeling better, I still have a family, And that's why I have an advance directive.
We can talk about many situations, right? I've been working in this field now for 8 years, and I think there's always nuances and complexities to the way that people think about medicine and the types of medical care they may want or may not want. And ultimately, I think it's hard to make a blanket statement because so much of medicine, I think, at this time is hearkening back to this idea of a doctor and a patient having a conversation about what's really meaningful, right? If you're seriously ill and we know, or best guess is that we're talking about a few months and you want to plan for how to make that time as good as possible, we can balance the types of treatments.
With the advancement of medicine and therapies to extend our lives even longer, we found that doctors are faced with concerns of new laws preventing them from possibly treating a patient with an innovative new surgery. The conflict also happens when family members and the patients have different wishes. One wants to prolong therapy, while the other party may not. The senior doesn't want to be saved. Their children want them to be saved, and is telling you as a doctor, save my mom. I don't care. She's not going to have a brain. No, I don't care. You save her. You save her life. And, what do you as a doctor do? And what happens? Have you ever had a case like that?
Yeah, absolutely. And I think the challenge is two things. One is, that's why I think doing shows like this is so important, because it's far better to have those conversations with your kids before you get in that situation, right? To make sure they know what you want. I almost think about it as a gift to say, I'm giving this gift to you, my kids, so that you know what decisions that I would want. It's a way to advocate for yourself.
Right. That brings us to the question of what does this very ill family member wish, and who is going to communicate this to the doctor? Do we know what to say to the family member if they had not made any of their wishes known? This is where an advance directive comes in handy. It outlines the client's wishes for treatment options in the event of an emergency, and they are not able to make decisions for themselves.
Even though we might have grown up in the same family, the same household for a few decades, we then go on and live our own lives and have separate lives and have different experiences that we bring to the table when we're talking about what, for instance, mom may have wanted in a difficult situation. I think kind of the art of good medicine is to really bring people together and to say, tell me a little bit about mom. What was important to her? How did she think about these things in her life? What gave her strength in her life? And trying to really focus less on the particular decisions of save versus not, and more tell me about who this person is. Because if we can understand who somebody is, then we can try to make a plan together about what is really concordant for them.
Talking about one's death is never an easy conversation. We are shown that it is a very important part of life to make sure you have all the elements, both physical and financial, in order. Most of us have heard of families fighting because their children have different opinions of how to help their parents in this life and death situation.
I would say the one thing that I think about in particular around this is, if I was talking directly to your audience and saying, what's important, what's the next best step, I think thinking about putting some sort of document in writing, like an advance directive that says who would speak for you if you were unable to speak for yourself, is really important for yourself, but also for your family. It's not just for people who are seniors or older adults. It's important for every adult 18 and up. And it's partly why I have an advance directive, because I can't see the future, right? And something might happen to me. So it's important for everybody. And I almost think about it as something that if you are filling them out yourself, that ask your kids to do it. Talk to your grandkids about making sure that it's done. It's just a normal, healthy part of being an adult in our society. The first thing is to recognize that both parties are acting out of love. I think sometimes we get frustrated with one another because we forget to see there's a commonality here. The person who's arguing to extend their mom's life for as long as possible, and the person who's saying maybe an extra day isn't worth the potential symptoms that that's going to cause. Both of those points of view come out of love.
It often helps to get an estate attorney involved. For a minimal fee, they can arrange all the necessary paperwork from a simple or complicated will and trust to an advance directive. Experts say planning this ahead could help avoid headaches, heartaches, and discourse.
The Institute is a behind-the-scenes player. We don't interact directly with patients per se. However, we do have physicians and others on our team who interact with patients in concert with clinicians. We have palliative care physicians who work with people with serious illness.
There are many questions to answer for those setting up an advance directive. Would you want to be kept alive on a machine? How do you feel about do not resuscitate? At what point do you ask for palliative or hospice care? Do you want to have medication to help with the pain management? These are all your family will discuss when planning for the future.
Our role within the Institute for Human Caring is to get into the public and make people aware that this is something that they need to complete and that they need to be having these conversations with their loved ones. A fantastic resource that we often refer people to is called the Conversation Project. Because a lot of times seniors will say, I want to have this conversation, but my loved ones don't want to have this conversation with me. What do I do? So that resource helps walk you through some conversation prompts and how to bring it up with your loved ones. And we often say that this is a healthy part of adult behavior. It has nothing to do with dying. It's about taking control and living fully, really.
So the best way to live a long and healthy life is to make sure you have all your health wishes known, and by doing an advance directive now. It is easy and doesn't take long to think of all the elements you want to know about, and just in case you're too sick to actually make those end-of-life decisions for yourself.
To make an advance directive legal, you have to go to a lawyer and spend money to complete the document. And that's actually not the case. All you need in the state of California is either 2 witnesses or a notary public. So in my role, I became a notary public so I could help the community members complete their advance directive easily.
I hope today's Senior Scene has given you the knowledge you need to have your wishes known. Getting an advance directive now is the way. You can go on Institute for Human Caring online and get that form. I'm Hope Witkowsky reminding you, knowledge, it's a powerful tool. Tune into Senior Scene next time for more secrets on successful aging.